Hi, this is a demonstration of Cardibot. Cardibot is a patient education chatbot designed for patients with coronary artery disease. Unlike general AI chatbots, Cardibot does not generate medical answers on its own. Instead, it uses a curated bank of pre-approved questions and answers that were developed and reviewed beforehand. The web interface here is running on a laptop, but the language model and retrieval components run locally on an NVIDIA Jetson device, so the system operates entirely on local hardware. So when a user submits a question, the system first checks for potential emergency situations. If the questions contain symptoms that could indicate an emergency, the system directs the user to seek emergency care. So here I'll ask an emergency question. I have crushing chest pain right now.
I can only share information your care team has already approved, and I don't have an approved answer for that one. Please reach out to your care team with this question. If this might be an emergency, call 911.
So here we can see the response to an emergency question. However, if the question is not an emergency, the system will search the approved knowledge bank for a matching question. If a match is found, Cardibot returns the corresponding answer along with its source. Importantly, the model never authors medical content. So here I'll ask an approved question. What is a blood thinner?
Anticoagulants are medicines that reduce the blood's ability to clot, which is why they are often called blood thinners even though they do not actually make blood thinner. They are used in certain heart conditions to prevent harmful clots. Because they affect bleeding, they are taken exactly as directed.
So here we can see that Cardibot found a matching approved question here and then gave the corresponding answer. However, if a matching question is not found, then the system will abstain from answering and points the patient to their care team. So here I'll ask a non-approved question. What should I do if I missed my heart medication?
I can only share information your care team has already approved, and I don't have an approved answer for that one. Please reach out to your care team with this question. If this might be an emergency, call 911.
So since this question is outside the scope of Cardibot, the system abstains from answering. So this is our demonstration. Thank you for listening.